Okay, so this is Gerd. This is my office, Dr. Jazayeri. I occasionally get patients that have very interesting lives, and so Gerd was gracious enough to let us interview her, and she's going to arm wrestle me. She says she beats everybody in her Taekwondo class except one guy. So I'm not very strong, but I'll take it. I decided to take the challenge. So can you tell me a little bit about yourself?
Yeah, I'm almost 71 years old. I was born in Norway in 1941 during the war. I was born actually in a German camp. It was not a concentration camp, but it was basically they took over an old prison, and my dad was a politician, and for some reason, which was never discussed in my family, he was arrested and sent to one prison, and my mom was sent to another, and she was pregnant with me. So I was born in there in 1941.
So you were born in prison?
Yeah.
Wow, okay.
And I was there till the war ended in 45. I was 4 years old. And I have a lot of good memories, maybe because I choose mentally to do that, because there was other kids in there too. And I remember one time we were out in the play yard. I was playing with some of the other kids, and somebody was dropping bombs. And this German soldier, he threw himself over me and this other little boy. And afterwards, tried to get up, and I remember saying, "Man, get up! Man, get up!" And he didn't move. Well, he was dead. So a lot of these soldiers, they didn't do this voluntarily.
Sure.
I mean, it was either do it or die. And so he basically saved the other boy and my life. And I remember the food. To this day, I cannot eat molasses, anything with molasses, because I remember the molded bread they would cut off and put molasses on it. But if I went out in the kitchens and sang for them, they had these sausages that was tied in the end with twine.
Mm-hmm.
They would cut off a little piece of that and give me, and that was like the treat. So I would go out there and sing my little heart out, for that piece of sausage. And anyway, when I was about 7, was the first time I saw my dad. And we went to the train station, and I saw these 2 guys in white coats and white pants holding up this skinny little guy. And I remember pointing, and I said, "Mom, look at that funny man." And she said, "Shh, that's your dad." Scared the daylight out of me. Unfortunately, I never had a good relationship with my dad. And I was sent away to private girls' school. And so, anyway, I graduated from the private girls' school when I was 15. Too young for something and too old for other things. But I didn't have a very happy childhood. So I decided to join the service, or go to the military. But of course, I was 15. And to go to the academy, you have to be 16.
This is in Norway?
This is in Norway. Well, having connections, they signed for me, so I joined. So I actually was the youngest one in the country, in the service. It was called Norges Lotteforbund, which means it's Norwegian army service, not army service, but military service. And you are trained to do different things for the department. Like I plotted planes for the Air Force. I was a dental assistant for the Army, and I did a lot of traveling between Germany, France, and England. And being the youngest one, I was kind of spoiled. I got those patent leather shoes because I didn't like to shine my shoes.
Maybe because you were attractive.
No, well, I tell you, there was something special about that. And I don't know if I should mention this on well, let me put this delicately. I was very well developed when I was young. So they always, when you are in line, I would always have to stay back about 5-6 inches from everybody else. So that when they looked on the line, they don't see certain things sticking out. It's true. I know it sounds crazy, but it's true. I since then had that taken care of, doctor. And we had ties, and I could never learn to tie the tie. So I went out and I bought the kind that had the elastic around the neck, and I put that on. And my CO, she was making inspections, and she goes, "Oh, perfect!" And she pulled the knob, and I was caught. I must have spent about 2 hours in the office learning to tie a tie. So whenever you need to have it tied, doctor, I'd be glad to help you. I think I still remember. Anyway, I come to America. When I finished my term I was lieutenant, and I was taught to train at the academy. And this was a problem because of my age. They would kind of giggle and laugh when I come in, because here comes this, little girl, you know what I mean? And I didn't really earn the respect, because they thought it was kind of funny. And my CEO called me in and he said, "Listen, you are an officer. You have to take command." And I did. And I got respect. And that has kind of stuck with me through life, because I became good friends with this American family, and we kind of was getting out at the same time, and they lived in upstate New York, and they said, "Well, why don't you come and stay with us and see how you like it?" So I did, and ended up meeting my husband there. And he was from New Hampshire, so I went from New York to the top of the mountains in New Hampshire. My English wasn't that good, but I taught myself by watching children's cartoons, reading baby books like The Dog Named Spot, asking questions, misusing some of the words terribly, because some of them sounded like, in English, sounded like something very obscene in my language, which I wasn't aware of until people were laughing. And then it was a girl that we became really good friends. She just died of MS not too long ago. And we still laugh about it today because, like I said, I'm not going to mention what I said, but she said, "Don't you know what you are saying?" I'm going, "No, but it sounds good." I mean, and she told me what it meant, and I never used those words again. And then I lived in New Hampshire, and I had 3 children. And as they were getting older, out there was nothing but sneaker factories, Davison rubber to mix dashboard for cars. So even if you went to the University of New Hampshire, unless you got out of the state, you really wouldn't have a job. So I decided when I realized there was really no future for my children in New Hampshire, I moved to California, and I worked at the state hospital as a psychiatric nurse for about 20 years. And I always was fascinated with martial art. Mm-hmm. And Bruce Lee was my hero. So after my children had grown up and moved out, and I decided to retire when I was 62, which was early retirement. And right around the corner where I lived, they had a studio, and they had a 2-week special. And I went over there, and the Grandmaster was there alone, because they hadn't opened for business yet. And I said, "I want to sign up." And he said, "Oh, you want to do the 2 weeks trial?" And I'm going, "No, I want to sign up." He said, "For the year?" And I'm going, "Yes." So I signed up, and I would go over there about 6 days a week. Mm-hmm. And he would help me practice. So normally it takes about 3 to 5 years to get your black belt. And because of all the training that he helped me with, I was able to do it in a year and a half to get my black belt. And then after that, you start working towards your degrees, 1st, 2nd, 3rd. The highest degree is 9. I personally don't know anybody who is that high. Most grandmasters I know is usually 5th or 6th at the most, because what happens, they've done it all their life. They start when they're babies, basically. Mm-hmm. And the things that goes out first is the knees. And then the back.
So injuries is what prevents you.
I'm now beginning to have problems with my knees. No problem jumping up.
Why? You're only 30 years old. I'm surprised.
I can jump up, but when I land, I can feel it in my lower back. And when I do a lot of kicking, especially when I do split kicks. Yeah. But you have a guy standing on a chair, holding the board, and you jump up and you do a split and break, the double break.
Right.
The groin kills me, and my knees is beginning
So
to
you
bother
can
me.
do a whole split?
Huh?
You can do a whole
Well,
split?
I would say probably about an 80% split.
Wow, that's pretty good.
And it's enough to break the boards.
Wow.
And then you graduate and you get into the cinder blocks. And frankly, I find it easier to do the cinder blocks than the boards.
You told me that.
Yeah, and a lot of people, you know, because you have to tape up your knuckles, because when you punch, when you box, you don't use these knuckles. Here, you use these knuckles.
Uh-huh.
And you use that as a center of the board.
Yeah, a lot of, you know, we call this a boxer's fracture because a lot of people hit with their little finger, and
Yeah,
that's actually the weakest, yeah.
Yeah.
So that's why it's called a boxer's.
You see how these are the tall ones? These are
Yeah.
the ones that you actually use, and you protect the others. by
Yeah,
tucking
those
them
are the
in.
weakest,
And it's just,
ones.
you
Yeah.
got to do it quick. Like the hardest one for me is to hold the board yourself.
Mhm. Oh, you have to hold it yourself.
That's one of the breaks. It's a lot of
Oh.
breaks. But if you hold the board and then you got to do this.
Right.
By that time my hands are sweaty and they slide. And by the time sometimes, you know, I have to do it 2 or 3 times, and then you can see the blood coming through the tape
Wow.
on my knuckles. But I love doing it, and like I said, I'm waiting for my gold star here, which is my 2nd level of the 4th degree. And I haven't
So
got
you have a black belt in Taekwondo,
a
right?
black belt, third degree. You get one
And the
stripe.
masters are 5th or 6th?
The master, a 4th.
So you're almost
I'm a
there.
master instructor.
Oh, wow. Okay.
The 3rd stripes is a master instructor.
Okay.
You have assistant instructors, which are usually junior black belts, and then you have instructors, and then you got, you know, master instructors, and then you get your masters. But
So I'm glad you're happy with my work because you could have kicked my butt.
I'm happy. I couldn't believe it.
Yeah.
I tell you, like I said, I took.
That put a lot of pressure on me because you could have really hit me hard.
I didn't even have a bruise.
Well, that's good.
And I stopped by Dennis and had a great big breakfast on the way home. I was feeling great. My husband, you okay? Are you okay?
Do you want to tell people what kind of procedure you had, or it's,
Yeah, I
we
don't
don't have
mind.
to? It's up to you.
The one that you did?
Yeah.
Okay. Because the husband others. But I will definitely recommend you because, first of all, you explain everything that you will do very clearly. And you're very conscientious, that I noticed. And while you're doing the procedure, you explain and show.
So you had the procedure was on the local, so you
it was
were
on the
awake.
local, we were talking through the whole
Yeah.
thing. And I was just extremely impressed. And I've already recommended him to my dental hygienist.
Yeah. Well, thank you. Unfortunately, my camera only takes 10-minute blocks, so we got about 4.5 minutes. Should we do the arm wrestling?
Yes.
All right. So Jessica, you take this.
Yeah.
All
Let's
right.
see.
So I don't know how you want to do it. Let me put my glasses.
See, this is,
Is that how we do it?
yeah, but this slides.
Oh, okay. Good.
Yes, it's
Should I be too? I got
Oh,
sweaty
you
hands. So,
got,
yeah, mine is worse than this. So should I go all the way? No cheating here, right?
no, look, 1,
Okay.
2, 3.
Well, you
1,
count.
2, 3.
You're pretty strong.
Come on, doctor.
I am. Are you even trying?
Yeah, I'm trying. I'm holding you.
I know. Wow, you're strong.
I slid hand on the floor. Yeah.
Well, that was a draw, wouldn't you say?
Yeah.
No, you're very strong. I'm surprised.
Well, that's when I think working at a hospital, doing all the lifting and stuff like that.
No, I wasn't backing down.
No, I could feel. I can tell usually when we lay down on the floor and do it,
Yeah.
and I see the legs start shaking.
Yeah.
I got him. I got him.
All right, well, thank you for letting us videotape.
Oh,
you.
you're
We appreciate
welcome. Thank you very much,
Yeah,
doctor.
so-
I'm very happy.
We'll put it on YouTube. You can
And-
watch it. Tell your friends.
I don't even know how to get on YouTube.
Oh, I'll tell you. Oh, it'll be on our website.
My
too.
son knows computer. He will do it. But I can say this was actually a very pleasurable experience.
No, we really enjoy having you as a
Because
patient. Just amazing stories.
Well,
and that's why
I
I will
think I-
videotape you.
I might be back for a couple of little tweaks.
Okay. Well, give me a
You
hug.
know?
Thank you. Thanks for. And we'll see you
Thank you
again.
very much.
We'll see you again in a month. Okay.
Yes, yes.
All right.
Later.
Bring something. Next time we want you to. I want you to.
Nunchucks?
Yeah. Bring some. Well, bring a board or something. We'll,
No, the boards is at the studio.
Oh,
they
okay,
are
yeah.
special boards.
oh.
But I can bring my nunchucks.
Okay. Next time we'll videotape.
Yeah, I need room for that so I don't knock over your.
All right. Take care.